It will take months to catch up on the thousands of surgeries and appointments cancelled due to a 5-day junior doctors' strike that started today. Members of the Resident Doctors Association have walked off the job at all public hospitals except Canterbury due to an ongoing clash with the district health boards over their employment agreement and rostering. I asked the DHB's National Contingency Planner, Aitcheson, how things are going so far at the hospitals.
Plans have been developed over a 2-week period, and at this point in time, each of the DHBs is managing well.
So no incidents of concern so far?
Not at this stage, no.
So, well, you don't need the junior doctors then, it would seem.
I don't think you could make that assumption.
So how long could you sustain this situation for?
I don't think anyone would be able to answer that question either. We plan in terms of the number of staff we believe will be at work, and those who are working additional hours. There's obviously a limit to how long additional hours can be worked.
So how much pressure does a 5-day strike place on you?
Significant pressure on the DHBs.
So can you be more specific? In what way? How?
As I described, when you have to ask people to work additional hours or do jobs they're less familiar with, it always places extra pressure on people. And when you have a workforce that isn't at work and other people doing their job, the unfamiliarity creates issues and problems for everyone.
Can you give us an actual example of that, Anne? What is a job that someone may be doing today that they will be unfamiliar with?
If you think about a charge nurse on a ward who normally has several junior doctors working, and those doctors aren't there, there are less people for that charge nurse to call on, and they don't normally prescribe the drugs, or they are not the people who make the discharge decisions or discharge the patients home. That charge nurse is under pressure to provide support she doesn't normally have to provide. And for the person doing that, even someone who doesn't normally complete the data into the computer, it's just work with which they're unfamiliar.
That sounds dangerous rather than unfamiliar.
We plan to ensure there are sufficient people to provide the support. So if you're talking about data entry, there are additional people available to provide that support. The purpose of a contingency plan is to mitigate all of those risks, and we've been planning for this for weeks now.
So how many extra staff do you have on as a result of this?
Once we have a strike in our sites, a lot of our elective services are cancelled. So people who potentially would have been running clinics today aren't running those clinics. They're working in the wards today. People who would have been in reception in clinics will be working somewhere differently. So we reallocate staff to ensure that the work that has to be done in the hospital is done in the hospital.
So how many staff have you reallocated then?
Oh, I couldn't answer that question.
You must know that. You're the contingency planner. Surely that would be a vital piece of information. Give us a ballpark.
No, I'm the National Contingency Planner. At each district health board, the planners there, the planning teams, reallocate staff as they need to.
So you don't have, nobody has an overview?
I have an overview of the management of the risks. I don't count the numbers of staff we reallocate. That will change. Those staff will move from place to place. That will change on a minute-by-minute, hour-by-hour basis.
So if you have an overview of risk management then, what would place any DHB under pressure? What is the situation that could place you under significant pressure during this strike period?
Anything that would place us under significant pressure has been covered by our plan or by the requests of the union to provide us support under the legislation's life-preserving services agreements.
So this isn't... That suggests that this is not disruptive at all in any way.
It is disruptive. We have cancelled patients' care, elective services, outpatient appointments. All of those kind of things have been cancelled.
And how many of those surgeries and outpatient appointments have been cancelled?
Thousands.
How long does it take you to catch up thousands of appointments?
Again, that varies from District Health Board to District Health Board, but it will take months.
So will you be doing anything to catch those up, like more super clinics?
And there's a number, again, each DHB does things differently. There will be extra surgical sessions run, there will be extra clinics run in order to assist with the recovery.
Can you say that there have been no, life-threatening or life-altering consequences of these surgeries being put off or not scheduled at all?
I can't answer that question for you. That's a question for a clinician to answer, but they make the decisions in terms of what's happening.
So it's possible that some patients' health could be the worse for this?
There's always a risk associated with any withdrawal of labour in a public hospital.
So what is the actual cost of this strike? And by this I do mean actual dollars, because you're having to pay senior doctors additional fees, are you not, as a consequence of this?
I'm a contingency planner. I can't answer those questions.
But those senior doctors will be part of your contingency. You'll be expecting them to cover. So are they not part of your planning process?
Of course they're part of the planning process. That's not the question you asked me. You asked me what the cost was. The cost is not a question for a contingency planner. I can't help you with that.
So when you do contingency planning as cost no object, you just make the contingency plan?
We have to develop the plan to ensure that those people who've got no choice but to be in hospital get the care they need.
So, Anne, just to be clear, when you make the contingency plan, there are no budget constraints on you, you're just told to make this work, whatever it costs?
The DHBs must make it work.
What is your biggest concern during this period?
I think that's a difficult question for me to answer, given that I'm conscious that hospitals are places where every day different and new things happen. I think my biggest concern would be that the hospitals continue at high occupancy so that the demand on staff is very high.
So is not one of your biggest concerns patient safety during this time?
That's what I'm talking about.
Okay.
Because the more patients we have in the hospital who cannot get care anywhere else, then the higher the concerns about safety are.
And that was the National Contingency Planner for the DHBs, Anne Aitcheson.